To answer some questions for us today here at Mount Sinai, we bring in Dr. Robert Parisian. An article in the New York Times was recently titled, "When to Try Physical Therapy Before Surgery." So my question to you, Doc, as a surgeon, when should we try physical therapy before surgery?
Well, I mean, here at Mount Sinai, we typically always trial physical therapy before proceeding to surgery. And I would say even larger in the greater orthopedic sports medicine community. Many times we attempt a trial of non-surgical management, which does include physical therapy. And there's other non-surgical modalities as well that you can attempt. And that's typically, in most cases, trialed before we proceed to surgery. And it really honestly helps us make those decisions as to which patients will benefit from a surgery. Those that which didn't get better or saw significant improvements during their physical therapy.
All right, let's dig a little deeper. Why? You mentioned a few of those reasons, but from your perspective, why is it always a good idea to at least include physical therapy or try physical therapy instead of surgery before surgery?
Well, plain and simple, it works. So physical therapy works, and it works in many instances. And we can't always predict. I mean, clearly we have a lot of research and we have data to suggest that in certain scenarios and circumstances, under certain conditions, patients are likely to improve with physical therapy. We know some of the risk factors, meaning, what patient contributing factors, either modifiable or non-modifiable, may contribute to them either succeeding or not succeeding with physical therapy. But at the end of the day, we don't really truly understand many times which patients will and will not progress physical therapy appropriately. And so many patients do improve with that route. I personally, like having patients go through the physical therapy pathway, because then if they don't improve with physical therapy, they return to the office and say, look, we've tried it. We've tried all the non-surgical modalities. Nothing has improved my symptoms. So therefore, now I am physically and mentally prepared to undergo a surgical intervention.
Is there something besides what you just mentioned that would make you say, okay, we've tried those things? And how do you know when the patient is right for surgery, or the situation is surgical is a good option?
So the way I discuss this with my patients, and I leave it with them, is that yes, there are a few things that may require a surgery that without a surgery, the patient may be worse off if they don't proceed. However, it's really the patient telling me and determining and letting me know that they haven't progressed, they haven't succeeded with non-surgical management physical therapy, and they are now ready to proceed with surgery. So I often tell them, when you come in, you have a specific injury or ailment. Yes, it's my job to go and with you try to figure out exactly what's causing that pain, and then I educate you and to say, this is exactly what your injury is. Here's what the here it is on the imaging. Physical therapy and other non-surgical management will be our pathway. However, if that doesn't work, here are the surgical options. So I really like to lay out the options and present the algorithm to the patient. And I leave it up to them to say, now you go off and do physical therapy, and I'll work very closely with your physical therapist. Bear in mind, it's not like sending you into the world of physical therapy. I want to work very closely with that physical therapist, so I have a back and forth relationship, and I know exactly what's going on with that patient. If there's any questions, physical therapist can reach out to me. So when the patient comes back, they say, yeah, they feel comfortable. They've been working with me and the physical therapist back and forth, and they then inform me and say, look, this is what we did. It hasn't worked. I still have this type of pain. And you told me if I kept proceeding and this pain persisted, that our next steps would be this. They're educated, and they really tell me that they're ready to proceed with a surgical intervention to address whatever it is that's bothering them.
Now, Robert, are there any conditions that you'd opt not to try physical therapy before surgery? Any situations that come to mind?
Well, there are many fracture situations, especially in orthopedic surgery, where we know that there's really not going to be a benefit from non-operative management or physical therapy. So those cases, you may proceed with surgery initially. ACL ruptures are another common injury in a young, healthy, competitive athlete that wants to return to their sport, especially if that sport is cutting, pivoting, jumping, and dynamic in nature. And so, an ACL rupture, and again, a young, healthy, competitive person or athlete may be one where we just consider going directly to the operating room. However, I would say that in many situations, even some prehab, some preoperative physical therapy can be very beneficial to help get that extremity and the knee, for example, or the leg when an ACL tear, get that leg in the best position, because the stronger a patient is going into surgery, they have good range of motion, they have good strength, they don't have any swelling. The stronger they go into surgery, the better they are coming out of surgery. So physical therapy can be beneficial in a whole host of ways.
Fantastic. Thanks so much for the insight in response to that New York Times article. We appreciate your time.
All right. Thanks, Jerry. Appreciate it.